Hi, this is Steph. This is our second video in the series of overview of the app. In this video, we're going to show you an overview of the Health Hub. So we'll share full screen now. So the Health Hub is the second tab along. We've gone through in the previous video all the features available in the homepage. You can view that on our website and on YouTube. But now we're going to concentrate on Health Hub. So the Health Hub is an optional extra that patients, after we started using the app, patients asked us to build this in for them. This does not link back to Vision, EMIS or System 1. This is simply optional for patients to use as a reminder tool for them, as a quick entry point for them. So let's see, again, this is built on a scrolling basis. So let's see the features here. So a lot of patients are on repeat medication. And very often they'll forget to take that medication or forget to reorder. So to make that easier, we've got a button here called My Medicines. So we've imported the entire BNF into here, and patients can again scroll to find what they're looking for or use the search functionality. And let's just say I'm taking this medication as a repeat. If I go on and say, let's say this one, if I add this as a repeat, I can add it as a favorite. I can say I want to take a dosage, let's say 1 tablet a day, for example, and I can ask the app to remind me to take it at a certain time. So let's say, there we are, let's say 4 o'clock every day. That's done. I can add multiple times if I wanted to, so I can take it at 9 a.m., 12, 3, whatever it may be. And I can add an end date or not. If I'm on long-term repeat, I can just simply leave that blank. I can also order a date, but I need to reorder that medication. So we can do that, and if I can add any notes I wanted to. I don't know, the patients can add their own notes if they wanted to, and confirm. Once they've done that, the app will remind them automatically. So if we go into the calendar here, we can see that medication has been added, and it'll be remind me with a push notification on my phone and on my smartwatch or on my smart tablet to take that medication every day at the allocated time. If the patient has put in a reminder of when to reorder, the app will automatically remind the patient to reorder and to visit the app's homepage and then to click on order repeat medication and access whatever system you have, or allow the patient to reorder. Again, you can build these from your portal, or we can do it for you. So that's a really good way for patients to remember, one, to take medication and to reorder. Very often, a lot of patients will come into surgery, won't they, and they say, I've run out of meds, and they've run out that day, and then we've got to run around trying to get a script organised. So hopefully this will remind the patients of when to take the medication properly, directions for taking the medication, and when to reorder. Secondly, and a list of all the favourites are there for the patient. So you can see now I've got My Medicines as a favourite, and I've got some conditions. So moving on to conditions, when a patient clicks on this, we've got a list here of chronic conditions we typically look after in primary care. If the patient is suffering from a condition which is not looked after in primary care, i.e. in secondary care, there's a list here for all conditions. And we can link this. This is linked to Wales at the moment, but obviously we'd link to your country's directory. And again, patients can scroll to look, or they can search for what they're looking for, and then they can get information, but only from NHS sources for this. Again, so that's conditions set in secondary care. For anything in primary care, we've imported again the entire NHS directory into this resource here. So if I'm a COPD patient, I can click on COPD. I can find out more. In Wales, we have an app dedicated to COPD. They can download that. But I can find the entire directory in here. There's educational videos there for patients. This is a video on correct inhaler technique. And then there's lots of forums, but again, or help or self-referral. But again, these are only NHS-based. We do not refer patients to anything that is not NHS funded here. So, but again, if you've got any localized pathways, we can again add this for you. So let's just say I do have COPD and I've favorited this. I can then view more information about the COPD, or I can put my annual review date in. So let's just say my annual review is going to be on the 25th of March. And again, the patient can put notes in here for anything they want. If they need to book blood before, they can put that in and confirm. Again, now if I go back into the calendar, then we can see on that date, I think it was there we are. So on the 25th, the COPD clinic is due, and that will send a push notification to the patient to remind them of that clinic. But more importantly, 14 days before that, the app will automatically remind the patient, 14 days before, contact your surgery to book an annual review clinic. So again, when I was a PM in practice, we employed administrators to chase patients up who are not attending their chronic disease clinic. You can set this by birth date, or the patient can set it up themselves. In clinic, you can set multiple reminders up if patients are poorly controlled. So poorly controlled diabetics, for example, can set monthly, quarterly, 6 monthly, 9 monthly, whatever they want. They can put multiple reminders in, but the app will automatically remind the patient because it's in their calendar. It's in their calendar here with a push notification to book and also to attend. So that's the reminder there. Now in the calendar also, this is a new feature that's been introduced again from patient feedback. Patients wanted the ability to add their own reminders into the calendar. So it really becomes a focal point for the patient. So again, they can click on add a reminder, and it can be for anything. Some patients asked that they had dental appointments or physio appointments or appointments in the hospital. They can then add these reminders in themselves, confirm, and again, that will add that reminder in to the app for them. You can see here, I've got a blood test booked here. I can click to say, do you want to remove it? Yes, I do. So it really gives patients the flexibility then to add any reminders in they want. Again, patients asked us to build that for them, so we've made that functionality available for them. Going on, blood pressure. So very often, patients are asked to record their blood pressure by a GP. So again, they can do this in the app. They can record the higher number, lower, systolic, diastolic, select their position, and select location where they took it. They can put the date in. They can even upload a photograph of the reading if they wanted to, and then save that BP reading. And each time that's saved, that reading is there for patients. Very often patients told us that we write it down, but can you build this in the app for us? We have a record of this. They cannot send this to you by into your vision. We did into Vision eMIS System 1. We have considered that, but GPs didn't want that just in case some BPs are elevated and medication need to be titrated. So this is really just for the patient to choose to use or not. They've asked us to build this, so we've given them that functionality. What else is there? So care plans. Very often patients may have care plans. Elderly patients came to us with this. They say, look, we've got a care plan. Can we add an image? So sometimes they misplace that. If they use it in the app, they can upload a copy of that care plan, either as a PDF or by taking a photograph of it, and that care plan is there for them if ever they need it, a digital copy then. Images, again, very often a GP may say to the patient, or a nurse prac may say to the patient, look, can you take an image of a mole, for example, to see if it changes shape, colour or size. They can take that image over a period of time, whatever's been directed by the GP, and the next time they come into the GP, they can show those images to see if it has changed or not. Again, this is not coded back into the clinical system. This is just purely for the patient to see and have that record there. And finally, contacts. So patients wanted us to give them the ability to upload important contacts. They can still do it on their phones, but they wanted everything into one place. Again, going back to the one-stop shop kind of idea, patients wanted their important contacts, so they can add a contact very easily, add a contact by name, job title, description, email, phone, address, and any notes they've got. And then examples could be a diabetic nurse. If they open up that, they will take up all the information then that the patient recorded, midwife, carer, whatever it may be. That functionality is there for patients. Again, the Health Hub has really been driven by patients more than GP surgeries. When patients are using the app, they've asked us to build these functionalities. We've got some more requests coming on board from patients, so we're going to build that over the next few months. But for now, this is what's available for patients in the app. So that's an overview of the Health Hub. In the next video, we'll go over the Your Surgery page. So please do view that to see what is available on the tab called Your Surgery. Okay, thank you.